I want to welcome Dennis and his wife Celeste Cecchini.
Wow, that was perfect.
Wow.
Wow.
I have it written down phonetically.
Maybe you should have heard some of the stories. That was funny.
We're very appreciative that should I call you Den? Is that
that's
Den and Celeste? Celeste.
You know, we worked on this at my house for 2 hours.
Yeah. Okay.
Practice makes it almost perfect.
First of all, the commercial is this. This is being sponsored by the Senior Freethinkers of Utah. For those of you that are unaware of our group, we basically are a group of seniors who are dedicated to free thought and reason. We like to discuss, evaluate, and form our own opinions on the basis of facts about everything, including religion, politics, and other cultural issues. We formed the group 3 years ago in March, and I was just looking back on our schedule 2 years ago in this room. In January of 2016, we had our first guest, and that was Dr. Gregory Clark from the University of Utah, who spoke about whether religion and science are compatible. And then a month later, we had Robert Kirby here, or rather in the big room, because we had 170 people here to talk about humor and to have some laughs.
Okay, now I feel bad.
Well, we had many other very interesting guests speak to us. And by the way, if you aren't already on my roster and would like to be kept informed of our programs, see me after the session is over with, and I'll give you some more information and get your information. The protocol for this session, and before I introduce Dan, he would like to make his presentation and integrate it with any questions that you have. I know in the past we've tended to request that you hold your questions, but Dennis prefers that if you have a question or comment while he's making his presentation, just raise your hand. If you raise your hand, then what I will do is I will take this mic and I'll bring it over to you so you can ask your question. Okay, Mary, you laugh, but when you get older and your hearing starts to fail, because while we might be able to hear Dennis without a mic, although he's got one, there are some of you we ain't going to be able to hear what your question is. So let me try to bring it over there, and if for some reason I get held up along the way or get lost, just speak loudly. Ask your question, make your comment, but please no speeches. Yes, and that applies to me as well. All right, on to our guest. I have to admit that on this very, very important and tragic topic, I have been mostly in the dark. And it really wasn't until Mary and Ron introduced me to Dennis that I started doing a little homework and was astounded at the significance and the gravity of this subject. I can't think of any other topic right now that is as compatible with the purpose of the free thinkers than to get the facts and a greater understanding on the topic of the opioid crisis and the toll that's taken and what we should be doing about it. I'm going to also do something different now than I normally do, and that is to say a little bit more about our guest's background than I normally do. And I'm going to do this because not only is it impressive, but it also, I think, sets the stage for the momentous decision that he made following the tragedy that affected his and his family's life. Dennis, and I'm going to use Dennis rather than his last name because I'm sure to follow that up, is an architect, as an architect in the state of Utah for 45 years, has devoted much of his professional career to the planning, design, and construction of K through 12 and higher education facilities throughout the state. He is the retired Chief Executive Office Emeritus of MHTN Architects, a firm that's been in continuous operation in Utah since 1923. Dennis held the position of CEO with MHTN from 2007 until his retirement in August 2015, after 36 years with the firm. During this time, Dennis was the lead architect, project manager, or principal architect on new and remodel K through 12 facility projects for 14 school districts in Utah, as well as architect on multiple higher education facility projects. Dennis retired from architecture following the death of his son, Tennyson, from a heroin overdose to devote his time and energy as an advocate for the prevention, treatment, and post-treatment of substance use disorders in Utah. Since July 2015, he is a sitting member of the Utah Division of Substance Abuse and Mental Health, Youth Initiative, and is the chair of the Council's Ad Hoc Committee on the Substance Use Disorder Consumer Guide to Adolescent Treatment for Utah. He's also a member of the Governor's Utah Substance Use and Mental Health Advisory Council. As a citizen advocacy for policy change in the Utah State Legislature, Dennis is working on legislation that will assist in providing outstanding outcomes in the prevention and treatment of substance use disorders. He has testified at multiple legislative hearings during the 2016 and 2017 legislative sessions, advocating for SUD treatment, insurance, and practice reforms, the availability of opioid antagonists in emergency overdose treatments, and the consistent use of the Utah Controlled Substance Database by prescribers and distributors of opioid pain medications. Pretty impressive. I want to point out, Dennis, before I turn it over to you, that in the back of the room we don't have, if you've seen the young men sitting back there, those aren't seniors who've taken very good care of themselves. They are seniors from Juan Diego High School, which Dennis worked on, and they're here on a service program for working, becoming the senior centers and other venues as part of their service requirements for their diploma. So thank you for joining us. Without any more babble from me, I want to introduce you to Dennis. Let's give him a hand.
I'm sorry you had to listen to all of that. told me he wanted to go into a little detail to set that all up to give you an understanding, but listening to all that made me tired again, so. I do appreciate everybody coming out today, especially with fog. I know that couldn't have been easy. Yes, sir.
Just, you a little louder, get it.
Louder?
Beside me.
This?
There you go.
Yeah, you gotta hold it just right, Dennis.
Okay. So, I want you to understand that when Don mentioned that my son died, it was a turning point in my life and my wife, Celeste's life. I want her to stand for me because she's part of all this. Stand up for all the people. She went through all of this as much as I did, maybe more. I want you to also know that I'm not really here as me today. I'm here representing my son, Tennyson, because he can't. I know that if he could, he would want to be very clear on what this epidemic is about. So I'm going to try to do that for him. Let's start with the epidemic, and I'll talk about Tennyson a little later. How's that? Let's talk about how bad it is. There was 63,600 deaths nationwide because of opioid overdoses in 2016. That's more than car accidents. That's more than a lot of other issues that would occur. It's more than died in Vietnam in 10 or 12 years. This was 1 year, and it's been going up and up and up. Utah is 7th in the nation in opioid deaths. We rank 7th. For a long time, we were 4th, but that was only because other states weren't reporting very well. Once they started reporting, we dropped to 7th. It hasn't changed, it's gone up, it's gotten worse. 80% of all heroin users start with prescription pill use. I'm going to say that again. It starts with prescription pill use. And I hope the people in this room understand this, because you will probably be working most with doctors. I understand that. And you'll have to know that doctors are part. Are there any doctors in the room? Because I'll tell you to your face, you're part of the problem. And the reasoning behind that is, and I'll go into that in more detail, is that for a long time, doctors have been forced to take care of pain in a way that is not required. It just is not required. So let's go on from there. There are 6 people that die of an overdose death in Utah every single week. Add it up, it's pretty close to 30 a month, and it's getting worse. This chart shows you how it progressed from 1999. You're looking down here, you can see that there are about 2 deaths for 100 population in Utah counties. You can see the cool colors, there's a few reds, but as you get to 2015, the whole state has gone orange and red and yellow. That's how it progressed. It got worse and worse. And what precipitated it? I can tell you that the cartels in Mexico and other places understood that we had become a nation of prescription pill users. We were self-medicating a lot with pills. And they realized that sooner or later we can't afford that. That what will happen is that we're going to have to go to a cheaper source of pain relief. And I'll call it pain relief for now because the drug has really nothing to do with total chronic pain relief. It's a short-term pain relief. That's all it's for. So they flooded the market with heroin, and it worked. Unfortunately, it worked. Let's talk for a minute about Tennessee. This is my son. You know, it's going to be 3 years in May, and it's still hard to talk about it, so I'm sorry. But his story is relevant because it is happening over and over and over to the children in our state. It keeps happening. And what we've got to do as a society, as Utahns, is stop this business as usual that is causing this to happen. I tell this to legislators all the time. Stop your business as usual, because what you're doing, what you're not doing, is causing our children to die. Let's go into that in a minute. I want to talk more about Tennyson. He was like everybody else, I'm sure. He probably was no different than the young men we have in the back of the room. He was born in 1982. He was our firstborn son. And you can see he was kind of cute. He obviously doted over it. He was our firstborn. He grew up, like most children do, had a lot of friends, played hockey. He was on the high school team, lettered in hockey. And he graduated from high school and went to Weber State University. He met a young woman named Christina. They fell in love, had a child in 2007. Tennyson continued to play hockey after high school, and he got a shoulder injury playing hockey. From there, that precipitated his addiction. Instead of fixing the shoulder, they medicated it, and it fixed itself. But the addiction happened. And that addiction lasted 10 years until his death. His death spiral lasted 10 years. And it's agonizing. The thing that Don said about maybe not knowing much about this problem was a problem that Celeste and I had. He was an adult by that time. He wasn't living in our home. So we had no idea this was happening. The problem with this addiction is that for a lot of years, they can function almost normally. It's hard to tell. You have to be very, very diligent in your children's manners, what they're doing, what they're accomplishing, what they're losing, and they will lose things. He lost his family, he lost his career, and he lost his health, all in a 10-year span. He died from a heroin overdose on 12 May 2015, and that was 4 days after leaving a residential treatment facility. He was trying to get rid of this addiction. He died on a bathroom floor while Celeste and I had to watch. All of our efforts, and all of most parents' efforts to help their adult children are for naught. They fail. The system is set up right now so that you will fail, especially with an adult child, especially with an adult child. The present treatment policies, stop family intervention. There are federal laws that stop you from being able to even know what the addiction problem is. Those laws have to be changed. They still are not. They still stop people. They're called HIPAA laws, and there's also 42 CFR, which is a federal rule that is really, really bad. That says that you can't even talk about someone who has an addiction unless they say you can talk about it. It's crazy. Information on this disease is very hard to obtain. One of the things you'll find is if you get on the internet, usually it's a runaround or some kind of a advertisement, I'll call it, to get into a treatment facility. None of which is helpful to parents or the afflicted person in trying to fix the problem, trying to help them get out of this addiction. So why are our children dying? There are lots of reasons. There's a lack of understanding about substance use disorder. Let me go into that for a minute. This is not a moral failing. This is a disease. It's a disease that most people don't wish to get. They think they are being helped by a doctor, and what they are really getting is addicted. You can get addicted to painkillers in the first 3 days. First 3 days. That's why it's so insidious in terms of what it's doing to our children and ourselves. There are lots of older adults who are having the same problem. And I got to tell you, I just as an aside, was working with the Department of Drug Enforcement. I work with them a little bit too on certain issues. And they're trying to stop this elderly problem where doctors are medicating, over-medicating older people. They're not really caring whether they die or not from the addiction. You need to be careful with that. The doctor may be helping you, maybe not. If you need a second opinion, get it. Bad prescribing practices. As we've been talking about, doctors tend to over-prescribe these pills. There are lots of reasons probably for this. But normally when you come to a real problem that no one seems to be able to fix, it's usually money. Now, Big Pharma is involved in this also. So from a standpoint of prescribing practices, giving someone 30 days of an opioid painkiller is not just irrational, it is dangerous to the point of death. You don't need 30 days of it. You shouldn't have more than 3. The CD, yes, sir.
And that's what happens. I mean, I had oral surgery about a year ago.
Right.
And the dentist gave me a prescription for painkiller.
Mhm.
I go and fill it, take it home, there's 30 pills in there.
Yeah.
And I only needed it for maybe a
Couple
day.
days.
I took one.
Yeah. What'd you do with the other 30, by the way?
I still have them.
Yeah. We'll get rid of them.
So what's the best way?
The best way is you can take them down to your city hall. Normally, most city hall, I don't know where you live, but most city halls will have a depository for that.
Oh, okay.
You can take it to, or call the police station, make sure they have it. You can take it down to your police station. Get rid of it. Having them hang around is a prescription for someone you don't want to use them to accidentally or on purpose use them. Remember, an addict is always looking for opioids. That's part of the curse when they get addicted. Most of their life is trying to get the drug, trying to buy it, trying to find ways to buy it. It's a horrible, horrible life. So get rid of it. But that's how it starts. There's no reason for 30 days worth of pills, but they mostly all do it.
Yeah, I thought I'd get like 5.
Yeah.
Yeah.
I mean, the CDC says you shouldn't get more than 3 or 5.
Yeah.
But they ignore that. And there's reasons for that. The Big Pharma are selling pills at enormous rates, and they are making billions and billions of dollars off of it. So remember, these are people who are making money off of killing our children. So don't be easy on them. That's all I'm getting at.
Hey,
Yes, sir.
so instead of an opioid, what other painkillers would they?
Well, oddly enough, a mixture of, and you're going to laugh when I say this, Tylenol and ibuprofen works sometimes just as good, depending on what your problem is. But there are a myriad, maybe not a myriad, there's many ways to help you through a pain situation that is not catastrophic. I'm not talking about opioids not being used if you just had a major operation for 2 or 3 days, okay? And that's all the pills you should get. Because obviously if you're in real pain, it's hard for you to get well. But when you go to a doctor, I'll give you an example. I played football in my younger days and ruptured a kidney when I was doing it. So what I get now is that when I get a cold, my kidney tells me I used to play football. And so I went to the doctor just to make sure that there wasn't something weird happening with it. And the first thing that came out of the doctor's mouth is, I can take care of that pain. With what? Well, with opioids. And I said, hell no, okay? The point is hospitals have been made, quite frankly, by whomever you want to call it, Big Pharma, big money, whatever you want to call it. They've been made to make the pain function a 5th vital sign. All hospitals are supposed to take care of those vital signs that could kill you. You gotta breathe, your heart's gotta pump, those kinds of things. Well, they made it the 5th vital sign. And it's not. It really is not. It is in certain conditions, but not all conditions. Yes, sir.
I was going to ask later, but some may have seen this. There was an episode on 60 Minutes 3 weeks ago.
About McKesson.
About McKesson, who's the
Yeah.
largest distributor,
Yeah.
who pays no attention in some little pharmacy in some little town, orders thousands of pills at a time,
You try millions.
millions.
They sent 1 million pills to a town of about 60, 70,000 people.
And you know what the sad thing was? Was the DEA
Right.
agent that was investigating this went to his superiors,
Right.
asked why there weren't criminal investigations, things like that. He was told because McKesson can hire better lawyers than we can.
And McKesson has a lot of money.
Exactly, that's it.
And I gotta tell you, this epidemic is fueled by money.
Right.
And Big Pharma has a lot of it. And that's why, and we'll go into this, there are some things that are happening now which may get them to change their practices at the very least, or get them to help pay for the things that it costs. So that's another part of it. But, those are all, the 60-minute thing was right on. Working with the DEA, they know that problem. They're trying to go around it
Yes.
in whatever way they can. Ineffective treatment methods. You'll be amazed at how many treatment centers use treatment methodologies that do no good. How many here are familiar with the 12-step program? Did your loved one go through that? I know Pat's had the same problem.
I've had children who went through this because one fell on roller skates, and I had a son, and I still have a son, but I don't want to tell you how it's destroyed their lives.
Yeah.
The worst thing is the system itself is, they can never have a life. They can't get jobs. And as parents, you try,
I would have brought this one, but it only goes this far.
you try and try to help and get them help, and over and over and over fails.
Yeah, it's
They
one.
may do well for a while, then they fall off and it fails. I'm talking years, draining everything. They lose everything, you lose everything.
Did they go through the 12-step program?
Oh, yeah, they went through the
Okay,
12 steps.
let me tell you the problem with 12-step.
Yes.
It's 90% ineffective in treating this disease. Doesn't work. It requires you to have a great, multiple, unforgiving foundation in religion, or at least another power, they would say. But the problem is that our young children believe in themselves.
Exactly.
And it's their right to do that. They're smart, they're right there, they know what they're doing.
But we also have to have a system that when you have some place to go, you have to find something to really help. You can't lose everything all the time and expect a different outcome.
No, this is.
And to put them in jails and then they can never get, it's so hard, and it's so hard to watch.
Right.
But I have to tell you one thing, I have one daughter now that has succeeded for 4 years, but it was all because of opiates, and then me screaming at doctors, and me fighting and fighting and fighting, told to leave the hospital. But you can see the diminishing of a human being to a point.
What age were they?
I've been going through this since the age of 25, and I hate to tell you, they're 50.
Okay, let's move on. Your story is, well, heart-wrenching. It's rather indicative of what families go through, as well as the SUD sufferer in all of this. And it is a function of the policies, treatment methodologies that don't work. I mean, there are evidence-based treatments out there, and there's probably 10 really good ones. Don't ask me to tell you the specifics of those. I'm not an expert at this disease. I'm only an expert at losing my son. But it taught me some things. It taught me some things that people ought to know, that people ought to take notice of and fix. And one is the way that they treat people who are suffering from substance use disorders. Group sessions, sometimes work, sometimes they don't. You have to tailor these treatments to the person, because we're all different. And most treatment centers don't. It's like a treatment mill. It's a bed. They're looking for the insurance. And so you're in and you're out. So that's another problem is this non-evidence-based treatment that goes on. The lack of treatment facilities. And what I mean by that, there's plenty of facilities out there. But one of the problems is that if they're going to take Medicaid because you don't have a lot of money, which a lot of these people go through, they can't have more than 16 beds. What a ridiculous rule. Now that just changed about 3 weeks ago when the Medicaid expansion came through that the state has been trying to get from the feds, which will allow them to be higher than 16 beds. Yes?
Is it in Utah, did they accept that medication?
Yeah. It's a limited extension. It's not the whole thing. Don't get worried. It's a limited extension. I wish they would accept the whole thing because we're wasting time. It's one of those things that we're doing that's killing our children. Without Medicaid, there's a lot of indigent people who can't afford to get into treatment who are where? Rio Grande. That's where they are, or where they were, until the DEA and the Speaker of the House, Speaker Hughes, and some of the cities and counties got together and started to put them into treatment whether they wanted to be or not and pay for it. And the Medicaid expansion made that possible. I was working with Odyssey House to extend the number of sleeping beds they had in one of their facilities in order to accommodate some of these people. And Odyssey House did this without the extension being granted yet. They did it on the come, which you have to give them credit for. Some facilities are trying very hard to save lives, very hard. So lack of treatment facilities is a problem. Federal adult laws, I mentioned those, HIPAA, 42 CFR. They keep us from doing the things that we would normally do to help our children just because they turned 18. And I got to tell you, the basic thing that we see is that a lot of this addiction doesn't necessarily happen before the age of 18. It does happen when they start to get into the processes that we force them into as adults. And I'll get into that in more detail in a minute. The adult involuntary treatment restrictions. Getting your child into treatment without their consent is impossible, and it's crazy. We've been counseled with Tennyson, and we had to kick him out of the house. We did that. I will never forgive myself for that. Do you know how dangerous that is? I didn't know at the time. It's horribly dangerous. They're on the street taking drugs. They don't even know what they are half the time. They got fentanyl in them, which is a real killer. It's a terrible thing to do. And that didn't necessarily get him into treatment. He finally just got tired of it and decided to get in. One of the things we're going to talk about is HB 286, which is a bill that was passed in the 2017 legislative session that will help in that instance, but we'll talk about that in a minute. Restricted insurance coverage. That's horrible. The insurance companies, in this state and a lot of states are ignoring the 2008 federal parity law, which says that you must treat with insurance a patient who has a mental illness or a substance use disorder the same as any other patient with chronic illness. So cancer, diabetes, substance use disorder, mental illness. They all have to be treated the same, and insurance companies don't. And we put up with it. Stop putting up with it. They don't even think you know about it, by the way. When I bring up the parity law to legislators who are kind of main legislators for the insurance company, they kind of take it back when I mention parity law and why aren't you enforcing it? They give me a lot of hobby. Okay, lack of prevention. Public awareness is important. How many people here knew or thought they knew about this disease before today? Yes, you would. And hopefully we're going to go into more insight into it. But there are so many people, like my wife and I, who had no idea. That's not our world. We weren't in that. We don't know that. And quite frankly, when we go to doctors and they want to give us something we don't like, we tell them no. We just did that. So we never had the problem. I had both knees replaced. That's another way that people get addicted, is because they get those 30 days of pills and they take them all because they think it's like an antibiotic, which it is not. The lack of continued recovery services. Now I'm going to tell you, we're going to go back to what Pat was talking about in terms of this revolving door of treatment. They go in, they're only allowed to be there on average 30 days for insurance. What happens after that is that they are detoxed, they are semi-understanding what the disease is, and they are still craving it like you can't believe. You cannot believe. This drug alters their brain like you will not understand. You can't fathom it. And so what happens is that without continued recovery services, which most insurance companies won't pay for, they continue to try to not take the drug, but they cannot. It's too powerful. Treatment is really a 6-month to a year intensive operation. Most insurance companies will laugh if you tell them that. So you have to come up with your own money, which is sometimes hard to do. You know, Celeste and I, we weren't rich. We're a little less rich now. And the bottom line is that happens to more and more people. That's why Medicaid is so important in all of this. There are lots of people out there who can't even fathom keeping their child beyond what insurance will pay, and most of them don't have insurance. That's the problem. So this lack of recovery services, USERA is an organization in this state that helps a lot with recovery services. And if anybody has a child suffering right now and they want even help getting into treatment or something, contact USERA. They'll help you do that. Just figure it all out. Let's see, the lack of money. Okay, this is a money issue, and we are not, as a nation, much less Utah, putting the money forward to treat this illness. How did we take care of the AIDS virus? How did we take care of Zika? How are we taking care of cancer? We're throwing a lot of money at the problem. We aren't doing that with substance use disorder. We're not throwing really any money. The president declares a public emergency. You know what that means? I ain't giving you any money, but I really care. Okay? That doesn't mean crap. It really does not. This has to be a national health emergency. Then there's money for it. And he won't even do that. Today's socioeconomic conditions, and this is what I was talking about earlier, in terms of what we are putting our children into. And you young men back there, you listen to this. This is a different age, I know that. The requirements of adulthood in this day and age are so much more difficult. I'll give you an example. When I went to the University of Wisconsin, Milwaukee School of Architecture, Wisconsin is the home of Frank Lloyd Wright, by the way. So it's quite a good school. Okay. When I went to that school, I paid $250 a quarter. Anybody fall off their chair? You know, you can't do that today. We're forcing our young people, if they want to get a good education and continue to go, they've got to fall into debt and try to get out of it later. It's not possible. They want to get a good job. Are there good jobs out there? There's some. There's some. But the bottom line with it is that you have to do the right things to get that job. And sometimes that's difficult for them to do. I can tell you that all the issues of trying to pay bills and all the things that we took care of when we were younger were easier to do. Bills weren't as high. They just weren't. So understand that our children are going through something a little different than we did. That doesn't mean you should give up. That means you've got to do it a different way. And you've got to work at it. You've got to work at it harder. I'm sorry, I was easy. $250, I worked the summer on construction. I had my whole nuts covered for the year. Housing and everything. So the keys to stopping this epidemic, they're pretty simple, but we're not doing them. Prevention, decent, correct treatment, and then continued long-term recovery services. Those things have to be provided if we expect to save lives. This death spiral that we're forcing our adult children into will continue until we fix each one of those. Let's talk about how we can make a difference in those. The Utah Department of Health, the Utah Parents Empowered, I don't know if you've seen their commercials on television, the alcohol ones, the Utah Naloxone people, and the news media itself. There are lots of news media participants out there who are helping to spread the word about this disease. We ourselves, Celeste and I, when we were working on the HB 286 bill, called Glenn Mills. I don't know if anybody's seen him from Utah Politics, Channel 4. Okay, you've seen him. But he was so helpful in this. We talked about what we wanted to do. He put us on his TV show. We talked about the necessity for it. He did several interviews with LeVar Christensen, Representative Christensen. Is he anybody's representative here? I think he's a Draper, not here. Yes, yours? He's a good man. He's a good man.
I worked for him.
Good.
I'm glad to hear that.
Well, the bottom line with him is that we worked on this bill since Tennyson died. The minute he died, we started to work on a bill because we knew that was one of the main reasons we couldn't save him. We couldn't get him into treatment. And once we realized he needed it. And the bottom line with it is that most of the legislators had no idea. I'm going to do a commercial here because he's really important. Most other legislators had no idea how to write a bill, how to read a bill, how to make a bill happen. LeVar knows all of those things, and he makes it all happen. I worked with a couple of other legislators before this, Celeste and I, until the 2016 summer, when LeVar got involved with it. Somehow I met him and worked with him on a controlled substance database bill, which required people to check the doctors to check the controlled substance database. And from there, he started to work with us on the treatment bill, and it passed. And I'll tell you how it passed. Passed in the House 61 to 11. Passed in the Senate 27 to 2. He don't fool around.
Good.
Okay.
Okay.
So, sorry, it's an important bill to get done. And he understood that, and he got it done. Yes.
What is naloxone?
Okay, let's talk about naloxone. Naloxone is an opioid antagonist, and that's a fancy term for if you are overdosing and you can get a dose of naloxone, a drug, it will completely reverse the overdose that fast. And I can tell you how important it is. This is my son, by the way. Billboards you may have seen around town. And Celeste was instrumental in getting those billboards up. We wondered why no one was talking about naloxone. I'll tell you why. He was in treatment for 60 days. We paid additional. We did the things we had to do to keep him in for 60 days. Apparently, though, the insurance company felt that 60 days was absolutely enough, even with our additional payments. And so we were told he was better. He was ready to go. He was released. And he was released in 2015 without naloxone. We were not told about it. No one understood it was out there that we knew. And so he was released without it. He went home 4 days later, obviously with pressures from people he used to know. He overdosed on our bathroom floor. And we were powerless to stop it. We didn't find out about naloxone until I called Carol Moss to get her involved in this other bill I was trying to get done. And she started to cry when I told him how he died. Because she passed the bill in 2014 that made naloxone available with a doctor's prescription. And none of them were given to us. You can see how policies are killing our children. You can see it?
Mm-hmm.
Sir in the back.
You just answered my question, but naloxone being a prescription medication,
It's,
I would think that as important as that drug is, that every middle school and high school should have that readily available on the shelf.
Yep.
Not prescribed for one individual, but be available for any number of kids that might succumb to an overdose.
Yep, you're absolutely right. And in the 2016 and 2017 sessions of the legislature, they fixed it. It is now available through your pharmacist. You don't need a doctor's prescription. You go get it just like you get any other, prescription, any other over-the-counter medication. It is completely harmless. It will not hurt a child who accidentally takes it. There's sprays, there's also injections. It won't hurt anybody who takes it who is not addicted. What it does to the addicted person, I'll get right back to you. It kicks the opioid off of their receptors in their brain, so it stops the opioid from slowing down their heart and their breathing, so they die immediately. And they get real mad about it, by the way. They don't like it because they go into immediate withdrawal. But the bottom line is they stay alive. And some people, and if you can believe this, there are some people out there that think naloxone is a bad thing because it makes people want to take the drug. Are they kidding me? Are they absolutely kidding me? These are the paradigms that are killing our children. I get that from police officers. Police officers. Sir,
So some law enforcement in, I believe, Cottonwood Heights and the county sheriff carry that in their vehicles.
Yep.
So does the paramedics for the
Yep.
fire department
No.
and the ambulances. So it's out there, and unfortunately, it's too late for some.
yes, it is, too late for some. Yeah, the Utah naloxone people are pretty instrumental in getting those in the officers' hands. They do training, they supply them with it, they are godsend for that. And that's why Celeste worked with them to get this billboard system put up that you see all over town to try to help people understand they should get it. Okay. All right, so these are things you can do. There's lots more. Talk it up. Bottom line is people have to understand this is not a moral failing. You want one? That's the kid. Do you have any? You don't have any, huh? You got one now.
Thank you.
That's not the spray that you actually.
You do have to inject that one. But by the way, just to tell you how great the pharmaceutical companies are, naloxone, when it was first out, nobody was using it. It was $35 a kit. Guess what it is now? It's $150 for the spray, and $120 for the injection, a kit. They just want your money. Yes, sir.
I see we're moving on to legislation and listening to you talk about the restrictions of insurance and mentioning a few of the legislators that I've gone head to head with over expansion of Medicaid. Tell me what your own opinion is about the legislature's refusal to expand Medicaid when, once again, we have a clear need for it. You deal with this, guys.
I know this is not the Republican ideology, but it's the most stupid thing I ever heard of. Couldn't be dumber. Couldn't be dumber if I wore a toupee. It really couldn't. The bottom line is it's money, free money, basically, and we're not taking advantage of it, and our children are dying because of it. We have to start helping. So that's my opinion.
Yeah.
That's just a father who lost a son. I didn't use it. I wouldn't have used it, but I've been contacted and talked to and helped many people who could have used it, because the main reason they can't get them into treatment is they can't afford it.
That is the main reason.
That's the main reason right now.
That's why our legislature is not pro-life.
I didn't say that. He said it. Okay, let's go through these things. The Essential Treatment Intervention Act. What that is, it's HB 286. You can look it up. It gives loved ones, parents, wives, relatives, the status to petition the court to get a quick hearing, to get their substance use disorder sufferer into treatment as quickly as possible. Yes?
Is it just for substance abuse or is it for other treatment?
Well, I don't know what you mean by other treatment. It's not
Well,
just for
like
opioids.
depression or those kind of.
Right now, it's just for substance use
Okay.
disorder. That's the way it was written.
Okay.
And I apologize for that. It probably should have included mental health issues, but mental health has its own methodology for doing that, and that's why we didn't get into that part of it. You cannot believe how difficult it is to get paradigms to shift in people's heads, especially legislators. This idea of that this is a infringement on people's rights. I used to get that all the time when we talked to legislators. You're going to infringe on their right to do what they want. Well, I want to infringe on their right to die is what I want to do. Can I do that? Well, that's the thing that they've got to understand, is that there is a point where we have to understand that this particular disease hijacks the brain. They aren't your children anymore. That's what makes it so difficult. They're a different person entirely. You can't, sometimes you can't even look at them. It's really hard. But the bottom line is we have to help them out of that. We've got to do it. So look that one up if you want, and if you need it, use it if you can't get them in there. The Controlled Substance Database Review. That was HB 375. That was another of our bill, which required doctors to check the Controlled Substance Database. Now, does anybody know what that is? What that does, real quickly, is that it's been around since 1995. It's one of the best in the United States. It is a database that identifies to physicians who will just look at it. It takes 30 seconds. That tells them how much and how long opioids have been prescribed to that particular patient they're working with. Now try to guess how many doctors were actually checking it in 2016. No, it wasn't zero. No. 10% were. 10% were checking it. So you can see this is kind of a conspiracy. Yes.
And I had the experience that doctors send people to what they call pain
Yeah.
clinics.
Yeah.
To help them
Yeah.
throughout this operation.
You know what pain clinics are?
Yeah, drug centers.
Legalized drug pushing.
Exactly.
Absolutely. And the DEA knows it, and the DEA is working hard to shut them down. There's a new sheriff in town, by the way, and I don't mean the sheriff, the woman. I'm talking about the DEA Utah special agent in charge. His name is Besser, and he ain't fooling around. He wants these pushers off the street. He wants this stopped. He knows that it can never stop unless these pushers are gone, and he's going to work hard to do it. And that's one of the pushers he wants gone, big time. Yes?
Yeah, I was trying to educate myself last night for this meeting here
Yes.
with you, and I found out that a doctor, Lynn Webster, who's still practicing medicine in Utah, he also ran a pain clinic, Life 3, I think it's called, and he had 20 patients that overdosed and died. The DEA raided his clinic, found a complete chest report, not chest report, but
Complete supply.
Supply full of deceased. It said deceased patients on it.
Yeah.
He's still practicing medicine. He didn't go to jail. They couldn't find enough evidence on the guy, and yet he's the catalyst, from what I read, to the entire country. This became the mecca for the startup of opioids because of this Lynn Webster, good old Utah.
Yep. Utah is kind of a first for a lot of stuff. You know, the DEA just caught a kid who was selling millions and millions of dollars of fentanyl online. Right in Holiday, I think is where he lived. Right in Holiday, right out of his house. And I don't know the whole story of that, but I'm sure if Agent Besser is working on it, he ain't long for a round. I'm serious. This guy's tough. You don't like it. Naloxone access. Oh, by the way, I want to go back to that controlled substance database. You cannot imagine how difficult it was to get the support on that bill of the what? Utah Medical Association. They fought it like tigers, just like tigers. LeVar had workshop after workshop after workshop to make it palatable to them. And they finally said the only way we'll support it is if you write a short bill that says the people in pain centers have to check the controlled substance database. They already had to. That was just to tell us to go away. And guess what LeVar told them? He said, you know, you've already heard Dennis's story about Tennyson. You guys don't work with me on this? And I'm going to tell that, I have him tell that same story on the House floor. And we'll talk about you, he said. So they finally let him do it. It had to be watered down somewhat, but they finally let him do it. We have to start taking our lobbyists to task, and I don't care who they are. Utah Medical Association should not have even blinked at that. Shouldn't even have blinked. Why are they blinking? Well, they're probably worried about a lawsuit. No, that's exactly right. They're probably worried about a lawsuit. Someday there's going to be a class action suit against them for what they've been doing, and they know it. That might admit they weren't checking it. Okay, naloxone access without a prescription. That's fixed. And the bottom line is you can get it right at the pharmacy without a prescription from a doctor, yes?
But nobody knows that.
Well, we're trying to get that word out. We're trying to get that word out. You know, the billboards were out for over a year, and Reagan just got a governor's award for helping us with that. So that was great that they worked on it. A lot of industry people are working to help on this. But the bottom line is yes, you're right. There needs to be more talk, more advertising, more understanding of what this is. That's one of the reasons I go around and do this. Training Utah physicians in SBIRT. Does anybody know what SBIRT is? Screening, brief intervention, and referral to treat is what that stands for. And what that's about is another prevention way of determining whether a person has a problem that is going to cause them in the future to maybe want to self-medicate and take care of those problems ahead of time. So right now we're working on, with the Utah School Boards Association and the Utah Superintendents Association to try to get SBIRT even into our K-12 schools, so that counselors, with the parents' permission, don't worry about the civil rights stuff, with the parents' permission, would be able to give the person an SBIRT review and identify whether there's any problem or not, and talk to the parents about what might be the issue that needs to be taken care of and how they might take care of it. I can tell you how important this is. Tennyson was molested by a babysitter when he was a child of 5 or 6. We only found that out when he was in treatment. And by the way, they didn't fix it before they released it. What I mean by fix it, they hardly talked about it a lot. But we found out about it. And the point with that is that that should have been identified when he was a child. I knew he had trouble sleeping. He'd go to doctors. Doctors would do what? They'd give him something to help him sleep. They didn't get into the problem. That's why training them on figuring out what the real problem is with SBIRT is important. That's why getting it into schools so that even if they aren't seeing a doctor, it gets help. Yes, sir?
The correlation between the legalization of recreational or medical, or both, marijuana, and that impact upon this scourge, opiate scourge. I saw some statistics that in Colorado, when that law of recreational marijuana went into effect, the incidence of opiate deaths or occurrences went down. Do you know anything about that?
No, I'm not a real expert on marijuana. I can tell you that the DEA considers it a real problem, and maybe that's not something everybody wants to hear. Because whenever they interview someone who has been picked up for an opioid addiction, in their interview it comes out that they started using marijuana some years ago. Now, I don't know what the statistics are, and I'm not going to get into it because I'm not an expert. I will say this as a private citizen. I am a private citizen. So I'll say it that way. The problem I have with it is that going, and I think most states started that way, they have an initiative out now for medical marijuana. While it's important to have another source to help, especially at our ages, with problems, with medical problems, it is important to do that. But what normally happens in these initiatives, and does anybody read the recent initiative for Utah? Have you read it? Read it? Read it, if you haven't read it. Basically, it sets up a methodology for growing, sets up a methodology for production and distribution, and it sets up a rather weak, what they all do, a rather weak way of determining who gets to use it. Your doctor sends a note to the state that says, they really ought to have this because, all they have to have is some reason. And you get a card, and that's the last you're ever seen. And you go get it from these places. So to me, I'm all for medical marijuana if it is a medical marijuana and not being used to basically get to the legalization of it, because I don't think it should be legalized. That's just me. Okay? Sir? Yeah, who? Somebody's yelling? No?
I said
Yeah.
it's an excuse.
It could be. I'm not going to get into exactly the rationale behind it, but I can tell you that I've seen it in other states, just as a private citizen, where it goes. Medical marijuana, lots of usage, let's legalize. Maybe that's the case. You done? You want to talk some more? No? You good? You good? Okay.
I said my piece.
Okay. Okay, again, prescribing limits to 5-day supply. Now, this legislature in 2017 did that. The only problem with it is for the first time, again, the UMA, is for the first time you get the pills. So after that, they give you 30 days. UMA, you people ought to start talking to them. I don't want to say they suck, but they suck on this issue. Funding provided for public outreach. Again, the legislature has been appropriating funding to the Department of Health to do outreach programs. Does anybody know what the Opidemic program is? Have you seen that on billboards and television and no? So it's working good. Well, bottom line is they're trying to get the word out and trying to give you a website that will help you understand this whole issue and get the help you need. And that all came from funding from the legislature. Don, how am I doing on time? They're probably over, right?
Yeah.
Well, I'll stop whenever you tell you to shut up. I'll do it. Making a difference through law enforcement. The DEA, as I mentioned, has been coming into Utah with a 360 program, they call it, where they're trying to get all kinds of community impact users with them to help them stop this pushing, to stop this problem, and to also provide better methodologies for treatment and recovery. That's the 360 part. It's not just enforcement to them. Again, getting pushers off the street, stopping the internet sales of drugs, and stopping overprescribing by physicians. I gave them a tip just a month ago, a physician who is overprescribing elderly and killing them and doesn't care. So hopefully they're on his case. Actually, it's a her. I said his so you wouldn't know what it was. I don't know.
Part of the problem though is us. Because I was talking with my doctor one day, and we were talking about prescriptions and that sort of thing. And he said that many patients that come into him aren't happy if they leave the office without a pill.
You are absolutely right.
They expect to get something from him
You're
that's
absolutely
going to
right.
make them feel better.
You're absolutely right. And what do we have to do about that? Knock it the hell off.
Well, we need to educate the people.
Well, you're doing it. Keep doing it. The point on that is he's absolutely right. And it's partly the hospitals forcing you into that, one way, because they put a little questionnaire out to you after you visit the doctor. What's on there? Did the doctor sufficiently take care of your pain in a satisfactory manner? Really? Does that need to be on there? You see, what happens is doctors' advancement in a hospital or use of a hospital or payment, those things are all done with that rating that thing sends to them. So when I see that question, and I don't know whether they read it, I write, don't ask this question, it's stupid. And believe me, I spell stupid right. Okay. Pending initiatives that are out there. Lawsuits against Big Pharma. Anybody see the press conference I think it was a month ago, wasn't it? Press conference, you see it? With Salt Lake County. The mayor of Salt Lake County, the Speaker of the House, Mr. Hughes, and their Attorney General, Gill, is creating a lawsuit, class action lawsuit against Big Pharma for their part in creating and perpetuating this epidemic. Now, what that's for is two things again, like I told you. One, to change their practices of dumping 1 million pills in a 60,000 population town, stopping the hospitals from having to ask that stupid question so that they can get doctors to use more of it, stopping paying doctors to be what they call thought leaders, they call it. And what that means is that they're supposed to go out there and get other doctors to want to use this stuff. The bottom line is they said in their original advertising for these opioids that they were not addictive. They were not addictive. And that they could be used for chronic pain. You know what happens to your organs when you use this crap over a long period of time? And I use the word crap because you can't. That's one of the other problems. But it really ruins your organs. So they need to be taken care of, and you need to support that through, calling your legislator, calling your county council members. Let's get them. Okay. Auditing Utah treatment centers for evidence-based practices. There's a pamphlet up here, if you want it afterwards, that identifies a program that the Division of Substance Abuse and Mental Health has been working on. They asked me to chair it the summer Tennyson died. They thought maybe I wouldn't be willing to do that, but I told them I was their huckleberry, and I did it. And the point is that that whole program is to go into the treatment centers that are at least licensed by the state in this. And there are treatment centers that are not licensed by the state, by the way. They don't have to be. There's not a law. Okay, that's got to be fixed too. But just remember, when you're trying to get someone into treatment, ask questions. Get yourself informed and ask questions about what's going on. And I'm telling you this as the dummy who didn't. Okay? I'm telling you that. So yeah, Tennyson went through a lot of trouble because I wasn't smart enough to ask questions for him. So what this does is trying to audit all of these treatment centers to find out if they are using the 10 basic key elements of evidence-based treatment. And if they are not, to try to help them get there. Now, we've had a slight setback because the group we've been working with, TRI, out of Philadelphia, has been falling down on the project. So we've had to step back a minute and find another group to help work on that. I think we're going to work with Utah, University of Utah, to get that done. Hopefully that's coming together. This SBIRD in Utah Public Schools, elementary, middle, high. Again, those are important things to get done. We're trying to get that worked out. You can't believe it's a slow process. I realize this may not be done for 3 years or 4. I might be dead before it's done, but you'll keep it up for me. Anyway, the bottom line with that is that it's important to get done, and we're going to keep trying at it until somebody puts it in play. We're going to start working with the school boards, the Utah State School Board, to try and get that as a policy for all of the schools in the state. Yes?
Is there a way when a person loses their job, because you know that happens?
Yep.
And
It always
then
happens.
If they lose their job, how can they get help? Because they cannot get unemployment.
No, can't.
They don't do anything to help you or help the parent.
Let me go into 2 things on this. One of the reasons we felt it was necessary to have an Essential Treatment and Intervention Act is because it is not a recorded system. You have no record when it is done. So even though the court forces you to go to treatment, you don't get a record like you do when you go to jail. Now, jail is the only real emergency way we have these days of treating our children. You can't get them in any other way, so they got to get caught with drugs and they got to go into jail. And that gives them this record. That has to stop. We've got to start using this process where they can get into a treatment facility without a record. The other part of the problem is that some recovery centers, the Red Barn, USARA, that's USARA, did I do that right? They will help figure out ways to help them get jobs. And there are employers, by the way, who are giving these people jobs, even while they're in treatment, because they know how important it is for them to get the work that they need. I'm going to give you some contact information, Pat, at the end of this you can take with you, and you can get a hold of some people and talk about your problems with you. Okay, I think what I want to do real quickly, if I can, Pat, or should I shut up?
No.
I can shut up anytime you want. She tells me all the time.
No, keep going.
Okay.
You got them.
I don't shut up, that's true, but she tells me all the time. Anyway, what can each of us do? Let's go through that quickly. Change that common thinking that is fueling this epidemic. You'll hear this all the time. Addiction is a moral failing. It is not. It's a chronic, lifetime disease. That's why it's so important to prevent them ever getting it, because it's a lifetime problem for them. Adults should be left to face this disease alone. They can't. They aren't capable of it. Their brain has been altered to the point where they even think like a child again. All they want is the drug. They can't help themselves. Adults should be left to face the disease. Pain is the 5th vital sign. It's not. You can live. Pain doesn't kill you. Addiction does. So start questioning doctors and tell other people to start questioning them when they're saying, I'll just give you a few million of these and you'll feel better. Don't question doctor's orders. Question doctor's orders. It's your body. Mental illness is not a factor. Do you understand that mental illness is co-occurring with most substance use disorders? My son was struggling his whole life, apparently, which we didn't know about, with this awful sexual harassment thing he had with a babysitter as a child. Those things occur most often, and that's why it is also so difficult once they get addicted to the drug for them to stop, because it does help them not think about it. Alters their brain to the point where they don't think about it. They just think about the drug. Advocate for funding and insurance policy changes. Those are important, and only we, as citizens, can make that happen. We need money, and we need insurance companies to stop screwing around. That's the bottom line. And don't give up on addicted loved ones, please. That's critical. You'll want to. It's tiring. It's debilitating. It is awful. You give up on them and they're probably going to die. That's all I can tell you. I think with that, I have these sheets up here that give you some contact information of agencies that can help you. In most of those agencies, if you mention my name, they usually won't hang up on you, but they might help you, okay? So with that, if there are questions, I'll take them. If not, if we're done, we're done. Yes,
I don't
ma'am.
have a question, I just want to tell you that I'm coming out of here much, much wiser than I came in.
Good. That's the point.
There are things I have no idea. Thank
Great.
you.
You bet. Thank you for coming.
Uh,
I want to ask a question, real quick.
Yeah,
Guys in the back, did you get anything out of this? You understand the problem? Help your fellow students, please. Spread the word. It ain't fun. It ain't something you want to get into. And don't let your doctors get you into it by accident. Anybody play sports? Yeah, well, I have two sons. I had two sons. Dennison was a hockey player. Palmer, my second son, is a golfer. Never had a problem. Contact sports are a killer if you're not careful with doctors.
Before you entertain any other questions, because I know some of the people may leave, I just want to say that I think I speak for all of us, that for you and Celeste and Tennyson's brother and the rest of your family, I think we can all empathize and think about what you've gone through. But I also want to say thank you for using that family tragedy to bring yourself, both of you, into this effort for the benefit of all of us in this state and beyond. Thank you very much.
I just want to say I appreciate the thank you, and I just want you to understand that sometimes I have difficulty with that because Tennyson had to die before I got into this. I hope that doesn't happen to anybody else. Be vigilant, get into it early, keep them alive. You had a question or an answer?
Yeah,
there?
again, I second what Dolly said. I think many of us are learning things we didn't necessarily know because we haven't had, fortunately, the personal experiences and so on. You talk quite a bit about what people like ourselves can do locally, that is to say, in the state in terms of legislation and what have you. If I'm not mistaken, it certainly was true quite recently, the pharmaceutical industry is the single most well-funded lobbying operation in this country, I gather, certainly at the national level.
It's a public emergency and not a national emergency.
Yeah, and you didn't talk about that aspect of the political activity that people might, be engaged in. I wonder what your thoughts on that. It's been said very often that pharmaceutical industry is a particularly large donor, for example, of our soon-to-be ex-senator.
Yeah, they are. They are, and he, I don't know, the 60 Minutes thing probably told you that. He was one of the instrumental sponsors of a bill that stopped the DEA from doing what they should have done. That's how, pardon?
I'm sorry. I
Okay,
have
do you want any?
Yes, I do.
That's right there.
Yeah, it's a really.
And you want to take one of those, and that's just a little synopsis of Tennessee. From the standpoint of Big Pharma, their tentacles go a long ways. There's a lot of it up at our hill also. It's one of the reasons a lot of this stuff took so long for legislators to start to do. You know what made the legislators start to do it? Some of them had courage. I'll guarantee you some of them had courage. And I put LeVar in that, she listens. I put LeVar into that category, and I put Speaker Hughes into that category, I put Ellison in that category, I put Dr., I forgot his name now, but there's a few, what is it?
Shizawa.
Red and Shizawa. He left now, but there are some people who have courage in this thing. I got a little story to tell you about Shizawa in a minute here, and I'll show you what it takes sometimes to get things done. But from this national standpoint, I think the best way that you can help with that is to start banging your representative in Congress about this issue entirely. Fix it, tell them. Quit horsing around. Put some money towards it. I don't care what you're thinking about in terms of defense. I don't care what you're thinking about in terms of roads. For God's sakes, we're going to put trillions of dollars into roads again. and we're killing them. You know, that's the kind of stuff you've got to start doing. You've got to start doing it that way. They don't listen unless you get angry.
And you can start tomorrow when there are going to be a handful of representatives here at this center.
And there's one other thing I really want to tell you. When young people get involved in this, they get married, they have children,
Yep.
and it affects their children's mental health. And because of what happens in their children's life, the same thing will happen to them. And when you see it like that, you really have to understand that this is really a huge problem. It won't just stop with them. It will go on to the next generation, because things happen to people when they can't run their own lives and they get hurt. Just like his son, what happened to him will happen to those children. There are predators, and so if you don't want to look, you better take a deep look, because it's the worst thing in the world to go.
It's everywhere here in Utah. I forgot to identify this young man right here. That's Tennyson's son, Jason. He came up to the hill, the lobby with us on the hill several times. And the governor was very nice to talk with him and help during the signing. So it does affect the entire family, and especially these young people. He's growing up without a dad now. Well, he has a stepdad now, but doesn't have his birth father, and that's always going to be something on his mind. I know that. I lost my father when I was 10 months old. So it's a long process. I was going to tell you a quick story about Senator Shinizawa when we were working on a controlled substance database bill. And we had that last workshop where they came in and threw down a half-a-page bill that just required a check by the pain centers. LeVar gave them that ultimatum and said, you better get some people back here to make a reasonable decision, because that's going to happen. Dr. Shinizawa was one of them that came back. They had several of the doctors in the Congress, in the legislature, who came back to talk with us, as well as the president of the UMA at the time. It was Dr. Peterson. I can't remember his name. But the point I'm making here is that this paradigm shift, this money involvement, is so strong. It's one of the things that we've got to work hard to break. In that particular meeting, LeVar had me talk again with these people about what happened to Tennyson. I also told them about an architect of mine in my office whose wife had a back operation, went terribly wrong. Doctors fed her pill after pill after pill after pill for 3 years. He was so worried about it, he used to come into my office and almost cry and talk about it. And we couldn't figure out how to do it, how to fix it, because she's an adult. She could keep taking it if she wanted to, and she was addicted by it. He was going to have some early morning meetings for the project. She got a terrible cold. She didn't want to keep him up at night because she had been the first 2 nights. So she went to the pharmacy, got a codeine-filled cough medicine, which added to all of the other medications she was taking, killed her that night. No one checked to find out if she should take that or shouldn't take it. So that was important. But what was kind of important to me in this meeting was that the president of the UMA, after talking about this for a while and talking about what happened to Tennyson and this woman, he started to cry. And he came over to me and he said, you know, I understand the problem. My son died of an opioid overdose last year. And he's there trying to tell us that we can't do this. That simple thing to make them check it. Dr. Shinizawa was also there. And he was also trying to push not to do it. He's a doctor, you know, trying to push us not to do it. And I turned to him and he said to me, Dennis, do you really think this is going to save anybody? And I looked at him and I said, Doc, if it saves one, is that enough for you?
Yeah.
Just one. He came over and sat down and we talked for another 30 minutes just face to face. Then he walked over to LeVar, put his arm around him, and said, I remember this today. He said, you get the language right, LeVar, I'll sponsor it in the Senate. And he walked out of the room. So my point is that everybody has to have their paradigms changed about this disease. It's not just because you don't know about it, even those who know about it have a weird thought about it. It starts here. Start telling the people you know to do the right thing, especially your legislators, especially your insurance agents, especially the people who can make a difference. Yes, sir.
Hey, Dennis, would you agree that when it comes to our students that we have to go hardcore on this? It's got to be visceral. You can go on the internet and see videos and photographs. I think just having someone speaking to a student to talk about it, just one to a bunch of kids may get to some, but if they see something visceral, I saw this last night, I think it was in Pennsylvania, a couple were driving a car, they overdosed on the side of the road, the cops came by and took a photograph, it looked like they were in an accident or dead.
Yeah.
It was that horrifying, in the backseat of a 4-year-old.
Yeah.
And the cops were chastised by certain groups by showing it, that he said, we do that again tomorrow, because you've got to see it front and center.
The groups who chastise them are part of the problem. The police are trying to do the right thing, most of them. There are some police who have the wrong idea about this too. But you're absolutely right. Our children, even at the age below 18, are young adolescents. They have to start understanding. That's why I'm so glad that there were 5 people here. They have to start understanding that this is a major health issue and that you can't screw around with it. You just can't. One thing that we have a problem with, I think, from our generations to their generation, is that they really do think they're invincible. You are not. We grew up in the 60s, my wife and I. You know, that's when drugs became, you know, kind of fashionable, I guess, you know. Well, we never touched them because we also saw people dying. We were smart enough to understand, I think, that that's not where we wanted to go and that you could die. I think sometimes our young people think that they can handle it, and they can't. They have to understand that. Once that drug takes a hold of you, it will fill your receptors in your brain, and you will want it and need it, or otherwise you go into detox, and that ain't fun. Yes, sir. You had something?
No.
You want me done? I can stop anytime.
No,
Keep going as long as you want.
waving goodbye. Well, why don't I, since we are losing some people here, normally that's the time.
That usually happens at the start of my class.
No, it's with Dennis Cecchini. If he can stay around and Celeste can linger here for a while and answer any additional questions you have or talk about things, they're available. Otherwise, we'll bring the official part of this to an end. Thank you very much.